Now, your host, Ken Broo, on News Radio 700 WLW.
Welcome back. It's the Craftsman Electric Saturday afternoon extravaganza presented by Craftsman Electric. Quality craftsmanship, it is in their name. Well, this is a story that may want you to take a little inventory as to what kind of health care you've got. Listen to this. A man and his wife were on the road. He had lost his job, and they were just hitting the trail just to see the sights. And they get out to Wyoming, and the guy starts feeling very ill. They go to an urgent care center out there, and they discover that the man's white blood cell count is through the roof. So the urgent care sends him to an ER. So they drove to a hospital in Wyoming, but then were airlifted to the University of Colorado Hospital in Denver. This is back in November of 2020. It was there that doctors confirmed the diagnosis of acute lymphoblastic leukemia. It's a very fast-growing blood cancer. And within 12 hours, this guy was literally making life-changing decisions. So they did intravenous treatments, steroids, antibiotics. They got him stabled. And then they thought it was best to go back to North Carolina, where they lived, where they could get help from their parents. And they went to Duke University Medical Center in Durham. So they called Angel Medflight, which is part of a company called Aviation West Charters in Scottsdale, Arizona. They told this man, Seth Dines, I believe is the way he pronounces his last name, Seth Dines, and his wife, Rebecca, that it would accept whatever the couple's insurer would pay and that they would not be held responsible for any remaining balance of that air flight home. So this company flies them back to North Carolina, then are taken by ground transportation to Duke. He spent 28 days as an inpatient. He got discharged. He was feeling better until the bills came in. This man, Seth Dines, purchased coverage through the Affordable Care Act marketplace with Blue Cross Blue Shield of North Carolina. And the 1,500-mile air ambulance flight from Colorado to North Carolina, along with the ground transportation between hospitals and airports, total bill, almost $500,000. Most of that was chewed up in that flight from Denver to North Carolina. $70,000 for the ground ambulance service to and from the Denver and Raleigh-Durham airports. This despite the fact that, again, this air care service, Angel Med Flight, told this man and his woman that it would accept whatever the couple's insurer would pay and that they would not be held responsible for any remaining balance. This is a pretty extreme story, but again, it's not a bad time to do a little self-check exactly what your insurance will pay and then how much you will pay of what the insurance company does not pay. Standing by is somebody that knows all about this. He's our good buddy Paul Seegert, managing partner, PCS Advisors, offices in 34 different offices around the country, and somebody that knows the healthcare industry inside out. Paul, how are you on this glorious Saturday?
I'm great. Ken, how are you?
I'm great. I'm a lot better than Seth Dines and his wife, Rebecca. Almost $500,000 for these air care flights after this Angel Med Flight told them that they wouldn't be responsible for anything out of pocket. Is that one of those too good to sound true things, or who's at fault here?
Well, you know, if it weren't for the fact that the Angel Med Flight told this consumer that they wouldn't be held liable, then I would say the consumer really was under some obligation to know their coverage better. But they did ask the question, is the impression that I'm getting from reading this story and digging into this, and it looks like they were misinformed, is probably the nicest way of putting it. And they were then hit with these bills, and only when media outlets got a hold of this did it go away, like some of these things can tend to do. Easier to get to just not chase them anymore than get the bad press and get more of a spotlight on some of these unscrupulous activities that add so much waste to our system.
Should they have
it's pretty incredible.
Should they have gotten this in writing? I mean, if I'm sure at the time they were told this, that they were having all kinds of things they had to worry about, and their brains were probably flying around 1,000 revolutions a minute. But should they have gotten this in writing?
Yeah, that is the best way to go. And Now, this happened in a little bit in the past here in just 2020, December 2020. Had it happened this year, we now have some better protections in place with the No Surprises Act that is supposed to help eliminate some of this stuff. It's not only been common in our system that you could get surprised like this with air ambulance flights. I mean, these are some of the most extreme examples because they generally are not, they're often not deemed medically necessary after the fact by the insurer, which is the case here. I mean, he had good care there in Denver. He didn't really need to go from Denver to North Carolina for better care. He wanted to do that to be around family, which is understandable, certainly. But the insurer gets to decide, is something medically necessary or not? Now, this Angel Med flight should have gotten this pre-authorized. They said they did. The insurer reports that they got the request for pre-authorization literally hours before the flight took place. So they didn't even have time to respond, and Angel Med flight did the flight regardless. Assuming most likely that they could bill this consumer.
Well, I would go after Angel Med flight. Legally, I would go after them, wouldn't you?
Yeah, absolutely. And it'll be harder for this kind of thing to happen now. Historically, for quite some time, if you're in a government paying program, Medicare, Medicaid, they couldn't get away with this. If they took Medicare or Medicaid, they weren't allowed to then heavily balance bill the members of those programs. Yeah. We didn't have the same protections for people that had private insurance, a plan off the exchange, and whether that be a plan off the exchange or with your employer or whatever. So this was happening in these kinds of examples. Also, more commonly and far more common than you would think, person goes to ER at an in-network hospital and has some services done, or whether it's the ER or not, they go for services in an in-network facility and don't realize that the person treating them, the doctor, the anesthesiologist, whoever it might be, is actually a contractor that is not in network. And how are they supposed to know? And that's led to all kinds of balanced billing over the years for insured and surprised balanced billing for insured people.
Why would a hospital, knowing that the insurance game as it is, that there's in-network and there's out-of-network, if you're doing business with a doctor that operates out of a specific hospital or groups of hospitals in your area, why would that hospital knowingly employ doctors that aren't part of the same network? Are they that strapped to find people, or is this something that a hospital or medical group, a game they would play to jack up the bill? I mean, it makes no sense for a hospital in a specific network not to have doctors and nurses or care, whatever it may be in that same network. It seems disingenuous at the very least.
Oh, disingenuous is probably the nicest way you can say it. I think the advantages for the hospital are in that it's a lower cost way to get those people in their facility, so it makes sense on their balance sheet. Not good for the consumer, clearly, which is why we've had to have this No Surprises Act legislation passed to try and combat this. Yeah. But the provider groups, the real business for many of these groups, the difference maker of how profitable or unprofitable they are is their ability to maximize billing within the rules. Yeah. And while this is unsavory, until recently, it was within the rules. You could just go into the contractor, be out of network, and then bill essentially what you want. And the insurer would pay a lesser amount of coverage, that out-of-network rate, and you had the freedom to balance bill the consumer. And this is a large part of the reason we have $140 billion in medical debt held by insured people right now in this country. That's just off TransUnion a couple weeks ago.
Yeah. So just to clarify, that example of someone going to an emergency, say you go into the emergency room, you have a rapid heartbeat, you have a heart attack, whatever it may be. Your doctor is in a medical group that operates in that hospital. Yet that hospital employs these contractors that aren't in your network, and therefore they will bill at out of network. Did that all go away with this No Surprise legislation that was passed?
That's the intent. We'll see how well they comply with this, but at least it's a big step in the right direction. It does ban surprise bills for emergency services, and that out-of-network deal. It should limit that quite a bit, and put some systems in place for that to get arbitrated.
I mean, you're lying in an ER bed, and they got all kinds of tubes and wires hooked up to you. You know, they're trying to fix you, save your life, whatever. What are you supposed to do? Stop and say, hey, by the way, are you in my network?
Are you a contractor?
And if you're not, right. What are they going to do? Say, no, that guy won't be in until a week from Thursday. I mean, it's like... I mean, just morally and ethically, I think this is a question that if you go to see your GP, doesn't matter who your GP is or what network they work in around here, that ought to be a question for them. If something happens and I have to go to the emergency room of Hospital X, where you or one of your specialists work out of, will you tell me that everybody that's going to treat me will be in network? And if your GP can't say yes, maybe it's time to find a new GP or a new health network. That's what it would tell me.
Yeah, that's one way to approach it. And then another thing, kind of buyer beware. If you go seek services, it's not enough to simply verify that the facility's in network. You have to verify that the various people involved that are going to be part of your treatment plan are in network.
Oh my gosh!
Now this will give you some protections, but yeah, it's pretty ridiculous.
It is absolutely that is absolutely outrageous. And I'm just wondering. You know, we've had in the last few years these no surprise things, and the hospital is supposed to line up exact costs for everything that a procedure you're going to have. I don't know how many are complying or whether or not that legislation is in effect.
That's a great topic of its own. It's in effect. Their hospitals are supposed to be publishing their pricing as of January 1 of last year. In my opinion, they fought it in the courts for 11 years. It was one of the very few good things that was part of the original Affordable Care Act, but they fought it for 11 years. They lose. They're supposed to comply January 1 of last year. As of a couple weeks ago, the last time I checked, 0.5% of hospitals in the three largest chains, 0.5% of their locations are complying. The fine's $300 a day. What do they care? $300 a day, they could bill that for an Advil. So, I mean,
then in hospitals, I can tell you that's pretty damn close. But it's outrageous. And so this med flight and the bill that wound up with this couple from North Carolina is an outrage in and of itself. By the way, we're chatting with Paul Seegert, managing partner, PCS Advisors, about this instance. Now, this couple had their insurance through the Affordable Care Act, Blue Cross Blue Shield, North Carolina. The Affordable Care Act, last I looked, there were over 30 million people, maybe, I might be off on that number, that had insurance through the Affordable Care Act. I'm wondering, are you more at risk for this particular thing happening under the ACA, knowing that it was designed for people who could not afford or were beholden to an employer for their health insurance that just wasn't good enough? Is the ACA more, if you have ACA insurance, are you more susceptible to something like this? Or is ACA just as good as whatever private insurance you may get from an employer?
Well, two questions there, really. You're not necessarily more susceptible to this just because you went and got your Blue Cross Blue Shield plan through an ACA or an exchange marketplace. It's really going to boil down to, was it medically necessary? And that's a pretty gray area that the insurers get to govern essentially themselves unless someone questions it. And so that's always going to be an issue if you're, and unfortunately in this case, the consumer was clearly misinformed, and that's egregious on the part of the med flight company. But it's not necessarily that, it's not going to make a big difference whether it's an ACA exchange plan or not, but is it a higher or lower quality product? It's generally lower quality. Separate question, I would say, because the out-of-pocket costs are very high. The compensation rates to the providers are often lower, so you have less access to quality providers. I mean, can be its own entire long-form interview as to why those are not as good in terms of the quality of what you get.
Oh, my goodness. Paul, good stuff on this, and also about knowing where the hidden costs are in hospitals that, again, as you mentioned, an infinitesimal percentage are actually reporting, despite the fact they legally have to. Thanks for your time. Appreciate it on a Saturday. Stay well, okay?
You too. Have a great day. Bye-bye.
Paul Seegert, Managing Partner, PCS Advisors.